Hi, my name is Sumaya. Today I'm going to be presenting a presentation on how to prepare for a whooping cough outbreak. What is pertussis? Pertussis is also known as whooping cough. It is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. According to the CDC, it is known for uncontrollable violent coughing, which makes it very difficult to breathe. As for any disease, pertussis displays early symptoms, and these can last from 1 to 2 weeks and usually include a runny nose, low-grade fever, generally minimal throughout the course of the disease, mild occasional cough, apnea, which is a pause in breathing, and this is especially in babies. Each disease has a disease process, and this includes the mode of transmission. Pertussis spreads from person to person by cough or sneezing, or when spending a lot of time near one another. According to the CDC, infected people are most contagious up to 2 weeks after the cough begins. The primary diagnostic testing for pertussis is polymerase chain reaction, or PCR. PCR tests vary in their ability to correctly show who does not have pertussis. This is important because if a test has high specificity, then someone tests positive, then it is very likely that they have the disease. According to the CDC 2017, diagnosis of pertussis includes history of typical signs and symptoms, a physical examination, laboratory tests which involve taking a sample of mucus with the swab of a syringe filled with saline from the back of the throat through the nose, and a blood test. The primary treatment for pertussis is antibiotics such as erythromycin, azithromycin, and clarithromycin. The incubation period, or the period of exposure, is an average of 7 to 10 days. However, this may range from 4 to 21 days. During a high-risk outbreak such as pertussis, it is important to protect babies and expectant mothers. The CDC recommends that pregnant women receive Tdap vaccine during each pregnancy to reduce the risk of pertussis. The recommended time to get these shots is the 27th through the 36th week of pregnancy. And as for any disease, prevention is key. Vaccinations are amongst the most controversial and effective ways. Being compliant with all recommended shots reduces the risk of developing whooping cough. Antibiotics are effective in treating and reducing the severity of the disease. According to the CDC, however, practicing good hygiene prevents the spread of respiratory illnesses. Each day, healthcare personnel are on the front lines of medicine and have a possible risk factor to developing diseases such as pertussis. Healthcare personnel who have direct patient contact, such as nurses, physicians, radiologists, even chaplains, should receive a single dose of Tdap if they have not previously received one. According to the CDC, Tdap can be administered regardless of intervals since the previous Tdap dose. As the President, I have included suggestions to effectively contain the outbreak. It is important to address issues that arise from the signs and symptoms of the outbreak. Identifying infections is key to avoiding further contamination. Utilizing all clinical and non-clinical staff, such as cross-functional teams, and delegating tasks to effectively function and contain the outbreak is important. I would initiate specialty vendors and address the aid in the treatment of the outbreak. And lastly, I would implement a collaborative leadership style and organizational decision-making to effectively address the outbreak and gain the buy-in department. Keep in mind, pertussis is a dangerous and highly contagious disease. However, it is treatable with antibiotics and it is preventable through vaccination. During an outbreak, early detection is important and in diagnosis and the interception of the disease. Proper PPE or personal protective equipment is required and all staff must follow guidelines and procedures pertaining to the outbreak. It is important to raise awareness in target communities where sanitation and population are risk factors. It is equally important to assess, delegate assignments to cross-functional teams for increased effective productivity.